Good afternoon, everybody, and we're really sorry we're late this afternoon, but thank you very much for joining us. We're really delighted to have had a strong response to this offer of a webinar to explain more about the National School of Healthcare Science accreditation process. Basically, what this came out of was meetings that we organized with the lead scientists in all of the trusts in the Southwest. And there was a strong message that many people would like to understand better what the accreditation process, and that this could help us with actually having more trainees. And we are very keen to increase numbers of trainees for the STP and HSST and ETP programs. So this is where this comes from. And I think I'll do some introductions of the people around the room from HE. So from HE Southwest, we have Graham Wilson, who is the Associate Dean for Healthcare Science in the Southwest.
Yeah, I wouldn't say no, actually, mate. Thank you.
Someone is not muted. I'm the commissioning lead for healthcare science in the Southwest, and Claire Lowe, who's on the call as well, is our commissioning officer. We also have help this afternoon from Josh Naylor, who is a medical physicist, but also a fellow funded by Health Education England for a short period, and he will be helping us with some of the questions and presenting as well. So that's us in the Southwest, but we also have from the National School of Healthcare Science, Liz, who's head of accreditation, and Jas, who also works with her on accreditation and has done basically all of the work for this seminar. So many thanks to Jas. And I think that's us from HE. And I'll have a quick word about whether you've just seen the agenda flash by. So we'll have an introduction, which kind of done from Graham. The accreditation process, Liz and Jas will go through. The department's perspective, that's where Josh is going to come in and tell you how it's been from his perspective to have his department reaccredited, which he's just completed. There will be a question and answer session for everyone, but also afterwards some breakout rooms, which will be sort of smaller numbers, perhaps easier to ask individual questions that you may have. And they will be led by Josh, by Cherith and Graham, and the third one by Liz. You do not need to do anything to join the breakout rooms. You will be allocated to them automatically. So that's, I think, where we are, and where I hand over to Graham, who's going to talk to you about Slido.
All right, welcome everybody. Fantastic to see such a large number of people. Many of those names that I don't actually recognise from the engagement I've had with healthcare science in the Southwest. So we're really excited at that, because the first impression is that our objective to introduce the National School of Healthcare Science and the commissioned programmes is hopefully going to work, because you've all agreed to attend. So I will move on to the next slide, which is an opportunity to please use your phone to join the Slido event, which my colleagues Liz and Cherith will be managing. There's an enter the event code, Accred22, no need to log in. And the question and answer tab allows you to ask a question, and you can upvote or downvote a question by clicking on the thumbs up and down. So at that point, I will just pause because my notes say to me to allow some time for you to do that. So I'm a good boy and I do like to do what I'm told by Jas. So I'm pausing for 30 seconds. I haven't timed myself exactly, so please don't email me and tell me I only gave you 20 seconds. But at this stage, I'd like to introduce the National School of Healthcare Science. What we have found with an engagement policy led by Helene and Claire and Ophelia within Health Education England Southwest is contacting healthcare science leads is that we still find that many people don't quite understand the National School of Healthcare Science and the role of the National School has in the commissioned programmes. And that's what I'm going to try and pass on some of that knowledge and detail to you in the next 10 or 12 slides. So the National School Healthcare Science, very grand title. We've been around since about 2010. I've been around since 2012, helping to set up the scientist training program, clinical scientist training, and HSST, and also involved in the practitioner training program and apprenticeships. So we cover just about every type of training program for healthcare science. We are firmly embedded in Health Education England, HEE, and we work very closely with the professional bodies to deliver the commission training programs. The primary programs, as I've mentioned, STP, Scientist Training Program, HSST, the Higher Specialist Scientist Training Program, and the more recent ETP, the ECHO Training Program. Now, we're unique, we feel, UK and globally. We have been approached by some other countries to ask about our experience and what we actually do. The school has pioneered the national commissioning of the scientist training. The HE commissioned scientist training for over 40 specialities, most of which you can see over my left and right shoulders. We deliver the career framework of all scientific healthcare professions. So you can start off as a level 2 apprentice and go all the way through to higher specialist scientist professional at a sort of consultant grade. And we act effectively as a national deanery and Royal College, and we do own the curriculum for the scientist training program and in partnerships with some of the colleges with HSST, and we set the assessment criteria. And many of you on this call may have already been involved in some of those discussions on and curriculum reviews that have recently completed. From a wider relationship, as the diagram shows, we're well embedded within HEE, and we link across with the HEE commissioning team, in this case for the Southwest Helene. We're also HCPC accredited, approved for the scientist training program. We work very closely with the HEIs and provider organisations such as yourself, and we cross over the 7 regions. We've now got an Associate Dean for Healthcare Science from the school within each of these 7 regions, and we work closely with our NHSCI colleagues within those regions. And the bottom, my left part of the diagram, as I've mentioned, working with NHSCI, professional bodies, the Royal Colleges, and now the evolving integrated care systems diagnostic board within NHSCI, chaired by Professor Dame Sue Hill, and we also work with industry. The school and the commissioning process. We've got a national commissioning team and we've got regional HE commissioning leads and regional scientists. And we all work together collaboratively to engage within the commissioning. So it's responsible for the expressions at the school, and the commissioning team, we're responsible for the expressions of interest that go out, and we'll provide you with more detail on that. The training program directors within the school cover all of the specialities, across the main themes of the life sciences, the physiological sciences, the physics, engineering, and the bioinformatics. We all have specific regional work, as I've mentioned, and the regional healthcare science leads, the commissioning team and the school, as I've mentioned again, work very collaboratively. It is a confusing relationship. It's sometimes confusing for ourselves, but we do hopefully get there and we do deliver. I think you can see the success over the past several years, and particularly this year in terms of the recruitment work and commissioning work that the HE team and national school team have done. I think it's upwards of 600 STP commissions. I'm sure Liz will be able to correct me if I'm wrong on that. The commissioning team and Helen have particular responsibilities towards the funding and the contracts, which are obviously essential to these to employing the STPs and the HSSTs, and we'll come on with further details of that as we go on. HE National Commissioning Cycle, we're looking at April, May at the top, priority areas being determined. Historically, or recent history is obviously cardiac respiratory, medical physics for imaging have been very prime areas, and in the life sciences, the microbiology, infection sciences have been very important. But that's not to say that, obviously, as a healthcare scientist for 35 years, I'm going to turn around and say that all healthcare sciences are important, and that's why it's really good to see a good spread of people here attending today. June, July, we'll start to look at the data and the capacity. From July, the expressions of interest will be going out towards yourselves, and from October, the commissioning team will review the initial expressions of interest, and from a December time, the final numbers will be agreed, and then the January-July period becomes a very intense period within the school in terms of organising the recruitment, receiving the applications from hopeful trainees and departments, advertising all of the posts, and then the selection process and interviews with workplaces to select the appropriate candidates. And then, all being well, when everybody's sorted and they've all got where they would like to go, the new trainees will start their programs in September. Now, the expressions of interest, the commissioning team process occurs annually, and as I've mentioned, it's usually starting a year before the appointment in the following September. You can imagine it's quite an intense process. There's a lot of checks and balances that have to be done to ensure that we get everything in order and have a successful recruitment and successfully employ the right trainees in the right roles. There's a link there about expressions of interest, and this is where it's really important for you to link in with your healthcare science leads within your trust organisation or your provider organisation, because they will be the people that we will be contacting when the expressions of interest are due to go out. I've mentioned that there. You must also your trust lead scientist, or possibly even your trust education and training lead. There may be some specific conditions that your department needs to have in place. Those can be explained. I'm thinking particularly with some of the reconstructive science roles and the registration requirements of potential trainees. The types of posts. You might not be aware of this, but there's actually two types of posts. There's a direct entry post, which is a trainee will be allocated to your department from the national pool, from the applicants that we receive. We annually receive something like about 7,000 applications around about January, February, and that's a very challenging process in terms of shortlisting. They also undergo a first batch of testing to situational judgment testing, and then followed by shortlisting. So that's direct entry. So that could be somebody who is just applying for a training post. And we've also got the in-service candidate, which is an opportunity for you to develop a member of staff who's already working with you in a substantive post within your department. And you're looking at your workforce plan, and you're looking at the individual, and you're looking at how you can develop your service and consider taking one of your existing members of staff and putting them through the scientist training program. Now, the in-service is a fully funded position, just like the direct entry. And I'll come on to a slide with what that means in terms of financially. So it is actually a fantastic opportunity. In my other career, we took on several STP trainees who are now successfully getting towards the end of their HSST training. So I would thoroughly recommend you as service leads to consider in-service as well as the direct entry opportunities. Now, hosting a trainee, you'll be required to demonstrate to the commissioners and to the National School of Healthcare Science that you meet the requirements of the HEE quality framework. Now, this quality framework applies to all programs delivered, all training within health education, within the NHS, that HEE has responsibilities for. And that quality framework is mapped across to the National School of Healthcare Science accreditation standards. And that is the document that you will be completing or required to complete and provide evidence that you can deliver the specific requirements of the training program, with a note, as I mentioned earlier, that there is new curriculum starting from 2022. I've seen some of this new curricula. It's really and they've really engaged with the workforce to actually review and update the programs to make them fit for purpose and deliver what you and the services actually need. And you can express your interest and apply for accreditation at the same time. And there's another link there. Now, go back to the funding. Funding is quite generous. It's Agenda for Change Band 6 plus the on costs, and that applies to both in-service and direct entry trainees. In addition to that funding, there is a £2,000 educational training support, primarily to support the travel and accommodation expenses of the trainees, because they will be attending university on the relevant master's degree appropriate to the speciality. And the tuition fees are already paid by HE as well, so that's not coming out of those the employer's costs. And we'll take this opportunity to mention the HSSTs, which is £13,000 a year to the employer to support any HSST expression of interest and a member of staff that you take on. And again, the tuition fees are paid for the HSST. Now, what is the department expected to know? Well, you need to be aware of the speciality curriculum that you will be delivering so that you can actually meet the objectives for the trainee. The structure and requirements of the program and how you plan to deliver all those aspects, including rotations, because there's a rotation element to the training, so that the trainee gets a broader view of their themed area, say in physiological sciences, than just perhaps just being the cardiac area. Who takes the responsibility? Right. Well, the day-to-day responsibility is the training officer, and what you're looking for are policies in place for fitness to practice, public and patient involvement, equality, diversity, inclusion, and whistleblowing. Now, many of those policies, I think you'll recognise, are actually organisational policies. And what we're looking for in addition to that is a clear plan, as mentioned earlier, on delivering the training for your trainee in the department. Now, experience of delivering other training in your department would be valuable in the submission of your application. And as I mentioned, you've got your department should have a clear training policy. This is today is hopefully going to provide you with the opportunity to have these discussions with some people in the workshops, but also to ask questions about what you need and what needs to be in that training plan, which my colleagues Liz and Jas will also explain. Who's responsible? As mentioned, each trainee will have a training officer who will oversee their training. And all staff working with the STP trainees should have an awareness of the programme and what is expected. And some of those members of staff will be or may be asked to do various assessments of the trainee as they develop and their training progresses. And it's really good to perhaps have an introductory session with the trainee to be involved with the department to ensure that everybody in the department understands roles and responsibilities. And the non-scientific clinical staff may also be involved in the training of the STP trainee. There's some aspects that support staff who may not be registered can often be the ideal candidate to do certain aspects of training. Who is responsible for the training plan? Well, the training officer should provide the initial training plan, which can be differentiated for each of the trainees on programme. The trainees should take more responsibility for their own learning as they progress. Initially, they're obviously going to be new to the programme, possibly not new to the speciality because you might have an in-service candidate, but as their confidence grows, they'll be able to identify opportunities and have that open discussion with their training officer. And I have mentioned a collaborative approach is really important here. Collaboration within the department, collaboration across departments, particularly when you're organising rotations and opportunities to attend MDTs and other events that might be happening locally or regionally. The big key here is to remember that your trainee is a trainee. They are supernumerary to your department. That's a very important aspect to consider when you're thinking of your in-service trainee and the fact that you are provided with the backfill money on that. So they shouldn't really be used for service delivery, but they will contribute to service delivery, and that ratio of their contribution will likely increase as they progress through their training program, and you feel more confident and they feel more confident in what they can actually do and contribute in the department. And one of the key aspects of this training role is that we're looking at a sort of 20% equivalent sort of 1 day a week ratio of time away from the actual day-to-day job, as it were, to do their training, to look at completion of tasks related to their master's degree. I think hopefully colleagues will come with a little bit more detail, but what are we looking for in the training plan? Ideally, it would be nice to have a week breakdown of the curriculum and the department training program, so that the trainee knows where they are and the department knows where they are, and that you can identify the learning outcomes that need to be achieved and when they are achieved. Where I've mentioned the supernumerary aspect of it already, the rotations need to be organised ideally in ahead of your application, so you're actually identifying individuals who or departments of where the trainee will go once they've commenced their training. As I've mentioned, time for the online portfolio, which I've just dropped in. There is an online portfolio which is has to be completed by the trainee. It's the opportunity and it's the engagement with the training officer and other members of staff in the department to evidence their development and their training and their competencies, and there are various activities within that: case-based discussions, reflective practice, assessments that need to be completed. Very important to have the one-to-one meetings regularly and provide good feedback to the trainees on so they can know what they're doing right, know what they're doing wrong, and know how they can develop on what they need to actually achieve. Also very important to liaise with the trainee and the universities on exam dates, reviews by the school, reviews by the university, and a clear guide within the training plan of roles and responsibilities, and many departments will have these details already in place. Very important, because we're in clinical situations, that we have a public patient involvement. With this, there's opportunities for the trainee, such as STEM ambassadors, Big Bang Week, Healthcare Science Weeks, opportunities for trainees to engage with patients, patient surveys, etc. A very important aspect, so that the trainee understands how the patient is at the centre of care. So they should be able to explain how the patients to the patients of how the clinical science contributes to their treatment. It's healthcare scientists, I think, in some areas have tended to be within laboratories or work environments that are not seeing patients, but things are changing quite rapidly, and many of the healthcare science roles are actually now seeing patients. And at this point, I will hand over to Liz, who is our head of Accreditation and Admissions, a job that I do not envy.
Thank you, Graham.
And Jas, who supports her, but just to say that the two of them do an absolutely fantastic job, and thank you very much for listening.
Great, thanks, Graham. Thank you for the lovely and wonderful introduction. You did a fantastic presentation there. Thank you, Graham. My name is Liz Plumb, so I wear two hats within the school. I'm head of accreditation and admissions, and Jas and I basically head up the accreditation team. So I'm going to be quite quick through our next bit, if we possibly can, because I'm very conscious that I want to leave time for questions and obviously the breakout sessions. So this is the accreditation team, a small but perfectly formed team of some wonderful ladies that support us with our accreditation activities. Headed by myself and Jas, Rachel, Nicola and Sarah form the accreditation team as it stands. We're not ogres. I think it's very polite of me to say it, and you can clearly see we're clearly not ogres. We're here to help. We're not here to prevent anybody becoming accredited. We're not here to make it difficult. It might feel like that in some cases in terms of what we're trying to get information out of you in terms of understanding the processes. We're here to ensure that we can work with trusts and departments to ensure that you can become accredited to deliver either STP, HSST or ETP in terms of the programmes that we offered. We don't want anybody to fail at this. We want you to become accredited. We're happy to support you. We're happy to help you. We're happy to buddy you up with others. Yeah, we're not difficult, I promise. It might feel like that in some cases, but we're not. So we are generally here to help. What do we do? So we accredit for STP, so the Scientist Training Programme. We accredit for the HSST in terms of workplaces. We endorse for the ECHO training programme, which is a relatively new programme that we have on our books as well. We work with the HEIs in terms of the STP and HSST accreditation, and we also accredit for PTP, so for the undergraduate programmes that we have. So we've got a lot going on in terms of what we're responsible for. So if I summarise that, we're responsible for the workplaces and also the HEI providers that we also work alongside. What we ask is, once you become accredited, is if anything changes, you tell us at the earliest opportunity you possibly can. So it could be the service has been reconfigured, it could be that the training officer's changed. There are various different forms that would need to be filled in just to let us know, so that we can basically continue with your accreditation and there are no surprises. As part of the accreditation, there's a requirement to do annual monitoring. It is exactly what it says it is. It's on an annual basis. It's all done online. It's not pages and pages. We're not asking for war and peace. What we're asking for is, have you got any challenges? Have there been any difficulties? Have there been any changes? So if you've forgotten to tell us that there might have been some changes within your department for staffing or whatever reasons they happen to be, it's just a way of us checking that actually everything is where it should be. So there are no surprises, so that we know that you are delivering all the training that you need to deliver. The support is there for the trainees that are coming into your department. So that's a formal requirement of retaining your accreditation. The annual monitoring is done on exactly as it says, on an annual basis. So collaboratively, what do? We work with a whole range of teams. So we provide support through the quality side of things. So my team will be responsible for the quality side of things. Within the school, there's a programme office that tends to do with more wellbeing and kind of issues around health support. But we do work quite closely together with both teams work closely together. We also work with regional and national colleagues, be it with our regional deans that are appointed within the school, be it with HE healthcare science leads and also quality leads. What we try to do is there's no surprises. We want to ensure that any trainee that we place with any of the departments that are accredited are it's a viable training environment. We don't want any trainee to have any difficulties as best we possibly can. Some things you just can't govern, it just happens, and obviously we work together to try to resolve it. But we want to make sure that because we're spending public money in terms of the funding that is associated with our trainees, that actually these are viable training departments, viable training experiences, and as Graham has already said around the training plans, the information is there, there are no challenges, and where there are any challenges or any gaps, we can buddy you up with others, and it might be that a consortia or a kind of a reciprocal arrangement might be needed to be kind of put in place, and obviously we can support you with that and guide you through that, just to make sure that actually all aspects of the curriculum are covered, because that is really key to make sure that everything can be covered, be it in the department, within the trust, or with others that you can collaborate with, to ensure that everything is there for each trainee that comes onto the programme, regardless of where they might be working for the next 3 years if they're on the STP, in terms of the programme that they've enrolled onto. We have quite regular meetings, so we will talk to departments as and when we need to, and obviously they can approach us whenever they need to. We meet with all of our HI colleagues now on a monthly basis, so we get them all together in a kind of Teams environment that they just come and share, but best practice, but also share with us some of the challenges that they might be having. Key to that has been quite essential through COVID, and trying to understand how they're delivering the training, be it face-to-face, be it online, be it a blended approach. And I think that has helped us understand a little bit more our HEI colleagues in terms of the challenges that they've had and how they've kind of done their very, very best to overcome some of those challenges in terms of how they've been able to deliver and continue with assessment and delivering their training as they've gone along the programme. These are the numbers. These are quite scary. This is everything that we've got to date in terms of all the departments that we've accredited, reaccredited for both SDP, HSST, and obviously ETP is the new endorsed programme that we're also working on. So when I look at that, that's quite scary, and just in terms of the volume of work that my team have done, and I have to thank them for all the work that they've done in terms of getting to those numbers. So what really do we do? Like I say, we are responsible for the quality side of the provision. We want to make sure that the training environments are viable, that everything is there, that the support is there, both be it in terms of the trainees coming into the department, but also that you understand what the requirements are of you in terms of supporting the trainees through the programme. So for workplaces, we endorse or accredit for 5 years. For the HEIs, we do it for 4 years, just because we think that's the best way to go with it in terms of the cycle with how HEIs would accredit their programmes internally anyway. And that's what that means in terms of what we do in terms of accreditation. This is quite scary in terms of this particular slide, just from the different hat that I wear within the school in terms of my recruitment hat. So potentially this year for 2022, we've got 674 new posts that we're actively trying to recruit to. These are departments that are obviously willing to take trainees. These numbers increase seemingly year on year. I haven't been in with the school that long. I've been here since 2018, but these numbers are going up, which is fantastic in terms of the healthcare science workforce. In terms of my rather small recruitment team within the school, it's a little bit of a headache, but it's okay. We will deliver on this, and we will ensure that these trainees hopefully get onto programme and they walk through the door. This is just giving you a snapshot in terms of what this year is actually looking like. So we've got a lot of work to do. We are supportive. If anybody has any queries or any questions, I would suggest that you ask us. Don't sit there and worry about it. Don't stress about it. If it's a question and the information isn't there, either on the website or you need to talk to somebody, by all means contact us. There's a generic email address we can give you in terms of accreditation. It might sound kind of silly, but no question is a silly question if the information isn't there and you don't know what the answer is. Come and talk to us. We are supportive. We are here to help. Like I've said, our intention is not to accredit departments. Our intention is to accredit as many departments as we can, ensuring that all the information is there, so that actually, like I've said, it is a viable training environment for any trainee that walks through the door in terms of steps onto the programme and they are able to cope with what we're expecting them to do. In terms of where we're at, I'm now actually going to hand over to Jas, if that's okay. There will be a time at the end to ask any questions. Like I said, if there's anything you think we haven't discussed or kind of come across as part of this webinar, by all means raise your hand, add it into Slido, but ask us those questions. We are here to support you and help you. So over to Jas.
Thank you very much, Liz. I'm just going to take control of the PowerPoint. Okay, so I'm going to run through, so what does it mean and what do we need for you to be accredited? Now, the most important aspect is to provide us with a completed application form with the appropriate signatures, and that's the head of department and the trust lead or the trust head of education. Now, you need to make sure those are signed and you tick all the boxes at the bottom of the form so that you agree to all the conditions that we say that you need to have in terms of a good training environment. That's to make sure that you understand that your trainee is supernumerary and that they need that time, that 20% time for training and education, and that you understand the roles and responsibilities of your department. And basically, the other things we ask for is a training plan. The training plan sets out what your trainee needs to achieve over the 3-year programme. And what we like to see on the STP programme, for example, is a week-by-week guide of what your trainee will be doing, how they will be meeting all the curriculum and the competencies and the objectives within that curriculum, and how you've put training opportunities within that delivery of that training. So, for example, the patient and public involvement part of that. And we also need to take a look at all your trust organisation policies. So we like to have those in as well. And we also like to ask you a structure chart to show your organisation. And we also want to know where your trainee fits within that organisation, which shows the sort of reporting line of that. So those are the most important things that we ask for. We also ask the training officer to fill in the evidence of meeting requirements training form. And that tells us, and that shows us, once you fill that form in, it tells us whether that training officer is qualified enough to support the trainee in the workplace. So those are the basics of what we mean. And it's not a short form, it is quite a long form, and we do give you a lot of time to fill it in. So it's not a just fill it in and it's a pass or fail. You can talk to us, you can communicate with us, and we will be there to talk you through the form. So please do get in touch if there's anything on the form that you're not sure about. So why do we need a training plan from an accreditation perspective? As Graham has already talked about this, the reason we need to do this is we need to see that the outline of the phases of training are there, and you have the capacity to deliver those in your department. We also want to make sure that you complete all the competencies within your department, and that your trainee will have time to do that whilst they're in your department. And the biggest thing that we often see missed off a training plan, which is really important, is the time for the progress reviews and the feedback with the training officer. We recommend at least fortnightly to make sure that, you know, the training officer and the trainee have time to sit down formally and have a discussion, which can be minuted and reviewed, and this is uploaded onto one file. We like to see an audit trail of this so that it's not just somewhere there, that there is a learning journey on one file to show how the trainee has progressed over the 3 years. And of course, we would like all the training officers to attend the trainer events as part of our accreditation process. So the new curriculum, which starts in 2022, as you may be aware that there was a curriculum review, and now that the curriculum for the STP programme has been updated, the departments that have expressed an interest for a training in September 22 will already be accredited if they're new to training on the new curriculum for 2022. There'll be a middle sort of where departments that are already accredited will have sort of 2 training plans at the same time. If they've already got trainees already in their department, they'll complete the STP programme on the curriculum that they started on. But if that department takes on any new trainees, the new trainees will be on the 2022 curriculum. So they'll be on 2 different training plans at the same time within that department. And the same with the reaccreditation. We'll reaccreditate you on the new curriculum for 2022, but you may still have trainees in that department who are working on the curriculum that they started on. So just to bear that in mind. We have now gone out to all departments asking them for new training plans with a closing date of the 27th of May. You might not all have this date before you say, oh, we've got till July, because some training departments that were accredited earlier, we gave them this as a condition of their accreditation to give us the training plans by July. So that just helps us with the large task, as you saw with so many departments, to manage the process. So some of you want to work in consortiums. I know Josh was speaking after myself. Definitely queried this with me some time ago when he was applying for his accreditation. And it is a really good idea to work in a consortia type of way. So basically you're able to share the delivery of your rotations, and some areas of the curriculum might be really niche, so only certain departments in the UK might deliver those aspects. So it's really important to be able to work with other departments and broaden the trainees' experience as well of how they can work with other departments, just to get a different flavour. And also to create networks for the training and training officers who can share good practice and have those discussions and create events within their region. So that's really important. And the more you collaborate, and the more we can actually increase that training capacity. So each consortium must have a training coordinator who works with the main point of contact for that group. There will be governance arrangements to show us clearly who has the responsibility for the trainees, what they'll be doing, when they're going to be doing it, and where they're going to be doing that training, so that everyone's clear of who is responsible for that trainee at any given time. Now, sometimes you may find that the consortia, there is a department that you want the trainee to go to that isn't accredited. This is something that we can work towards. It doesn't have to be accredited at the time, but we can work towards that. And of course, departments can have their own accreditation, like UCAS accreditation. So sometimes we can sort of work around that. We want to be as flexible as we can with this, so that the trainee has the benefit of lots of training opportunities. And the last thing I want to say is about the information and resources available on the website. I will put a link in the chat box in a moment, but we have had a revamp of the accreditation section of the website. You'll find it here under information and resources. And then you'll see all the different areas of help that have now been revamped, so that you can actually get all the bits of information that you need. There's also a frequently asked questions section and useful documents section where you can find all the applications and everything else. So that's all from me. So what I'm going to do is forward on now to Joshua. So over to you, Josh.
Hey, yeah, do you want to do questions now, or should we save them?
Sorry, that's my fault. I should have carried on sharing the PowerPoint, but I can do that now.
I'm happy to go ahead now, or if people want to. I know that you had a section for questions.
No, that's fine.
It's got a hand up.
If someone's got their hand up, do you want to go ahead and ask your question and mute yourself?
Yeah. Yeah, sorry, it's Julie Hewlett here from Torbay. I'm just interested to know whether or not the training officer can be a dual role, because capacity issues are a little bit challenging, but actually to be able to support a bit better and more and fully, I'm thinking maybe that a dual role would be possible.
Can I ask what you mean by a dual role?
Well, there has to be a named training officer, but could that be two people and listed down as the training officer, so that one person is always around to support, so to speak? Or does there need to be a lead training officer with delegated responsibility?
Normally it's one person, but actually, if you think that you could have, I mean, my only concern with having two is, will that confuse any individual trainees that might or might not come onto the programme? So I think as long as you're clear who does what, there's no overlap, and it's clear for the trainee walking through the door, that's fine. I think it might, in my personal opinion, it might just give you a few more headaches than you possibly need, Gillian.
Okay.
But I'm more than happy to discuss that. I don't believe anybody's asked me that question before, so actually no question, it's a silly question. Normally it is just one person. Graham?
It's a very good question, Gillian. And I think where you may be coming from is if you're putting your sort of training plan together and your training policy, we certainly, when I was working in the laboratory, had a deputy training officer. So yes, there is a training officer who has a clear responsibility for the trainees within the department. But as you say, if that person happens to be off on their annual leave and you don't want your trainee to be feeling unsupported, then having a deputy role there would be something that would be very sensible to have, and just make sure that they would be listed within the required documentation, and also make sure that they're included in any of the appropriate training that the school delivers to support training officers.
Yeah, okay, great. It's just we were just thinking that actually to have more bodies involved would be better for sustainability and just to be able to support better, really, because we've had a lot of operational pressures, and actually hedging our bets might be a little bit better to have like a lead and a deputy.
Oh,
I don't think that would be a problem. I think as long as you're clear, Gillian, in terms of any trainee that might walk through the door, who's responsible for which aspects, or if it's a shared responsibility, it's dealt with in a shared way so that nobody's confused. I don't think that would give us any headaches, in fairness.
Yeah, and I think it's really good that you're actually considering, actually wider involvement, because that's what we've said within the presentation so far. It's good that the whole department actually takes a collaborative approach to supporting the trainee.
Do you want to do more questions on Slido after me, and then if anyone has anything they want to ask, they can just ask about all of the presentations?
We can go to the Slido questions if you want to. Yeah, we can do that.
Why don't we save all questions on Slido till I'm done? It's not going to be long, my bit, and we can.
That's fine. That's fine. Whatever you know how you want to do it.
That makes sense. Yeah, let's do that.
Okay.
Yeah, so I'm Josh. I work at Poole Hospital. That's part of University Hospitals Dorset now. And I work in radiotherapy. So Jas is doing the slides for me. So if you carry on, there'll be lots of clicking for Jas. Yeah,
that's so okay. You just let me know when I need to click.
I'm in radiotherapy physics, and I've worked in that field since about 2009 or so. And then I've been involved in training and been a training officer for the STP since about 2017. And I am, as Helen mentioned earlier, since October last year, I've been doing a fellowship with Health Education England. That's a couple of days a week, and that's for all of medical physics, not just radiotherapy. And it's looking at expanding the training capacity for medical physics. So if there's anyone on the call who's not yet accredited, or indeed is doing reaccreditation, or it's coming up for them, part of my fellowship is actually helping you if you need it. So Jas and Liz both offered their help, and I'm going to talk about that a bit later as well and reiterate that offer. But if anyone needs help from someone else who's gone through it, I'm very happy to do that. So a bit of background about us as a centre and our accreditation process. So we originally got accredited in 2015. If you could go on the next slide, Jas, thanks. And that was when it was done through self-assessment. I wasn't involved at that point. It was before I was involved in the training. And then in October 2021, we reaccredited, and I did that accreditation. We took the decision to include Dorset County Hospital. Jas mentioned earlier about the consortium working. We didn't actually do all of the formal consortium paperwork, but we wanted our trainees at Poole Hospital to start going for some of their rotations to Dorset County. They have a small medical physics team there, but they've got a vast amount of experience with radiation safety, and so our trainees are going there for their diagnostic, like imaging rotations and the radiation safety parts. And we actually in radiotherapy at Poole have a satellite centre at Dorchester with one LINAC, and we staff that, so we go ourselves to work there. So it just made sense to kind of unify things across Dorset in that way. The eagle-eyed amongst you might notice that the reaccreditation timeline is actually 5 years. So we were a year late, but I had a pretty good excuse because I fell off my bike and fractured my femur. And was off sick for 2 months. So one of the few things I managed to miss on my return was the accreditation, and the accreditation team are so far from being ogres that they were very gentle in chasing me. And yeah, so we did it a little late, but it was backdated. So if we go on to the next slide, we just to recap on the application pack. The others have gone over this in some more detail, but kind of to summarize, there's 3 areas that documents fall into really. The first of these is the department and the trust itself and the kind of paperwork side of things for that. And then the second area is to do with the staff in your department and who's looking after the trainee. And just to speak to that question earlier from Jill, so I'm the training officer for our radiotherapy trainees, but I actually got a colleague to supervise the rotation for our first year trainee. So kind of day to day, I suppose they were acting as the training officer for that rotation. And I definitely agree. I think it was Graham said about the holistic training from the entire department. It's just we will produce better clinical scientists if we have everyone in the department, and indeed from other departments and hospitals if we can, training someone, because we all have our unique ways of doing things, and the way that I do a certain procedure or a treatment plan or however, some bits might be good and some bits might not be so good, and someone else does it better than me. So if we let our trainees be supervised by multiple people, I think that's for the better. Although, of course, they, as Liz said, they need clarity on who their line manager is, and the school, I guess, need to know who's a contact to speak to someone about that trainee. So that, yeah, the third area for the application pack is focused on the trainees themselves. So since I did the accreditation, Jas and others, I'm sure, have put in a load of work and really refreshed it. So I had a look at what's on the website now, and it's quite different to what I did in October for the reaccreditation. So I had a bit of a look through, and it kind of falls into 2 areas really. The first of these is for the national school, and it's these different evidence domains in the application pack. And so for the evidence, meaning that you have to submit proof that you meet those domains. If we could move on, Jas. So there's one on education and training quality. So basically proving that you're going to do a good job of training. And then there's one of like planning for the trainee, and then the resources that are required for them. And then the final domain for the national school side of things that you need to submit actual evidence for is health and safety and equality and diversity and patient and public involvement. And most of these things in that domain, I would say, you would have to hand anyway. And then kind of the second part of the application pack is for the HE quality framework that I think it was Graham spoke about earlier. So if we move on, Jas. And I actually hadn't really heard of that, and I didn't know where to find it. So I've put a link in there for you to look at. But that's actually a self-declaration. So it's not quite the same as the other section where you need to provide kind of tangible evidence. You really, I think, a bit like the training officer form, you're kind of having a bit of a think and telling the truth and saying whether you meet the areas. So on to my very unofficial tips. If we can move on, Jas. I picked this picture because it really does feel like quite a mountain to climb, I think. like, I'm not going to lie, it is a lot of work. And when I first read the application pack for and this was just for the reaccreditation, although I think it's quite similar, I was very daunted. So my first tip, if you move on, Jas, it would be to start early. And that's, although it isn't kind of pass fail, they do set a deadline, and you will need to ask colleagues for certain things. So I would get cracking on it when you kind of get the stuff through. But I suppose make sure that your head of department or whoever is your line manager knows about it, because you're going to need to kind of spend a reasonable amount of time on it. My next point is to think of the trainees. So I think it would be quite easy to look at the accreditation stuff and the application form and just see it as a box ticking exercise for the national school and to keep them happy. But actually, we're all doing it for the trainee and to give them a good experience and to produce excellent clinical scientists at the end of it and for our workforce. So I think put yourself in the shoes of the trainee and kind of think, you know, I'm doing this training plan or scheduling these catch-up meetings, and to do a good job on it so that they get a really good experience. My next point sounds a little bit strange, but I did check with Jas before including this, and it's to do the minimum that you think you can get away with. And because it's not pass fail and it is a collaborative process, I would say it would be very easy to spend a really long time on kind of writing things out and amassing documents from people, and then the accreditation team might look at it and be like, blimey, like this is a lot of work. Actually, I think if you work very collaboratively with the accreditation team and ask questions and say, is this the kind of thing you're looking for? And again, as I said, put yourself in the trainee's shoes. So you want to make a good experience for them, but you don't need to go too overboard on it, I think. And that leads on to my next point, which is to get help. The accreditation team are really great. When as I say, I felt a bit daunted at the start of it and thought, oh no, what if I mess it up and they take our trainees off us or something like that? That couldn't be further from the truth. I had a call with one of the team, and they were really helpful, and we looked through the stuff together, like on Teams, and it really helped me make a good start on it. And then my final point is to buddy up with other departments. I think the accreditation team can do that officially, and then unofficially, like people like me who you might know have gone through it recently, or other specialties within your hospital, or other of the same specialty at other centres, perhaps in the region, and just try and copy what they've done. Like, there's no point spending days writing a training plan for let's say a radiotherapy trainee, if you can just take someone else's and then amend it to suit your department. And that actually is going to create a better experience for the trainee anyway, because it's utilising what others have done. Yeah, I think that's probably my main points really. So can I feel free to ask me questions today, or email me or in the workshop. Thanks.
Thank you very much, Josh, for your presentation and coming to share that with us. There's some really useful tips there, so thank you for that. We're now going to go over to the Slido questions, and I can see that there's one here that's a curriculum related one. Is the new curriculum on the website neurophysiology? Is the new curriculum on the website? Yes, it is on the website. All the curriculums for 2022, apart from microbiology, which is going to be 2023, can be found under the curriculum section, in the section that I showed you. So There's one more question here. Currently, STP training headed by an HCPC registered clinician, but could STP training be headed by an RCCP registered head of department, or is HCPC required? Anybody able to answer that question?
I think whoever you think is appropriate in terms of whoever is there and is able and willing to kind of head that is absolutely fine. I think as long as they know what they're letting themselves in for, be it the head of the department or the training officer, and they meet the entry criteria into it, especially for the training officers, there's specific information available in terms of what we expect the qualifications to look like and the person spec in terms of the requirements of the training officer. Have a look at that. It is all on the website. It shouldn't hopefully be too much of a surprise for anybody. But yes, if you think they're appropriate, then that's absolutely fine. This is left to your discretion in terms of any trainee walking through the door. Just the only reason we ask for named training officers and others is so that actually we are confident that you've got the staffing in place. They know who's coming, they know what their role is, and obviously it's about no surprises in terms of any trainee walking through the door.
Graham, have you got a question?
No, it's not a question. It's to support what Liz has just said, but also to add to it in terms of, I think many of us are familiar with the complexities of professional registration within healthcare science, with the HCPC, clinical scientists, biomedical scientists, but also RCCP registration in the Academy of Healthcare Scientists. So if you've got the appropriate, the qualified and experienced member of staff, as Liz says, then that's fine. But it's also a very good question, because what it does emphasize is the nature of the fact that what we are training people to be clinical scientists. That clinical scientific input is essential, and sometimes you may be going to some of your medical colleagues who in some areas may be heads of department, and making sure that you're engaging with those people so that you get the valuable clinical support that's required, and for the training of the clinical scientists.
Thank you, Graham. And a question from Dominic. I believe we are due for reaccreditation this year, but to my knowledge, no reminder has been received. Thanks. Liz, would you like to take?
Don't worry, Dominic, something will be coming your way. You don't need to contact us. We will contact you. We'll look into that for you, but please don't stress. Something will definitely be coming your way if you're due for reaccreditation. That goes for anybody who's due for reaccreditation. And also in relation to the new curricula, we've contacted the departments. We don't expect you to contact us. I mean, if you want to start it earlier, we won't stop you. So if you feel, Dominic, you want to start it now, that's absolutely fine. We don't normally get so much keenness from our colleagues in departments because they're balancing everything else that goes off in terms of everything else they're trying to deliver in terms of service. But yeah, leave that one with us. We'll come back to you and we'll double check it. Thanks,
Liz. Another question here is no mention of ASP as yet. Are there any special arrangements for ASP?
No, there aren't. In terms of ASP, it's dealt with by a slightly different role within the school. It doesn't come through the accreditation team as it stands at this moment in time. It's actually managed through the curricula team. There have historically been a slightly different arrangement. There's a form to fill in, and I forget what the form is actually called. Chris Fisher, who heads our curriculum team, we can get that information and we can share that with you after this event. I can't for the life of me remember what the form's called in terms of the ASP, but it doesn't sit within the accreditation in terms of any formal requirements along those lines.
Thank you, Liz. In cardiology, there is a separate department accreditation for STP and ETP, or would STP accreditation cover the ETP trainees also?
Yes and no. What we've said is if departments are already accredited for STP where cardiac is concerned, then we are confident that the majority of the training for the echo is there and it's already in place. What we do need to understand is who, if anybody, is any different in terms of delivering that training in the department. So we would need some assurances around the support that's there. We would need a slightly different training plan as well, because the ECHO programme is an 18-month programme. Obviously, the STP is a 3-year programme. It is slightly different. So we just need some assurances, and we've got a bit of a triage system going on where the ECHO is concerned in terms of whether if you have STP accreditation, that means you don't have to fill in so much paperwork, but you do still have to give some assurances that everything is there. If you've got professional accreditation, where that's concerned, there's a slightly different approach there. If you have neither any accreditation from the national school, then obviously it's a bit more full information that is required, just to make sure that actually we have the information about you, your training department, and what you can deliver in terms of the staff and the support that are in place, and just signposting you to some of the trainer events as well, just to make sure that you've hooked into the school and what we do. And what we should have also have said, and I forgot to say it in part of my kind of presentation, is the national school has monthly newsletters that we send out. By all means, please sign up to those. We can send you the link if you need that in terms of who to contact where they are concerned. It's just a matter of keeping in touch with us, and we're just sharing some best practice and information that's available. We have specific ones for the SDP and HSST. So please, if you're in any doubt and you want to kind of be a bit more closely aligned to the national school, please sign up to those. It will give you a lot of information on a monthly basis. That is just sent into your inbox in terms of electronically. It isn't anything that comes in the post. It's not quite that extreme in terms of what we do and how we share that information out. And it might be that there's some good practice within that can be shared as well.
Thank you, Liz. There's a couple more questions. Is there HE funding for the role of a training officer, and is there training descriptors?
There's no funding for the role of a training officer. There is a descriptor in terms of what we expect in terms of the role of the training officer, and also who is eligible to be a training officer in terms of the qualifications and their background. Again, that's information within the pack that Jas has alluded to in previous kind of conversations here today. If in any doubt, like we've said all along, do come and talk to us. If it's not, if anything isn't clear, or we haven't got our messaging quite where it should be in terms of if you've got any questions, come and talk to us. You know, I know I keep saying this, we're not ogres, I promise. You know, no question is a silly question if actually the information that is there isn't enough and it isn't clear enough for you to understand it.
Thank you, Liz. Graham?
Yeah, unfortunately, currently there isn't funding from HE in the same way that our medical colleagues receive funding and for their PA time, and we often see that within the nursing environment within trusts, they have their practice education facilitators. But what I would like to say is there's an increasing awareness of the importance of these roles locally and regionally. And where Josh is on a fellowship, for instance, that it is the sort of start of that role to be able to support departments across regions, and we're hoping that there'll be some additional funding coming through HEE. So I think it's very important to engage with your healthcare science lead for any information that comes out by HE Southwest on any of opportunities for these roles that may develop over the next few months to support departments in training.
Thanks, Graham. I've got one. I think this has to be the final question. I have applied for reaccreditation last year, but not heard anything yet. Any idea why the delay? That's from Steve Perring at Poole.
No, I generally don't. I mean, we're a small team and we're trying to get there as fast as we can with any accreditation. If it is as we can't find that, it might be it hasn't been received. I don't know. We'll look into that for you and we'll come back to you as soon as we possibly can. Have we got your email address? I'm sure we must have, Jas, in terms of contact.
Yes, I've got your email address. If you can just put in the chat box what specialty area it is, and then we can definitely make sure we get the right information. Thank you, Steve. We've got about 15 minutes left, and we're going to reduce the breakouts to about 10 minutes. So we've got 5 minutes to come back together in the main room. So what I've done is I've allocated everybody into your rooms. So it normally takes about 20 seconds. I'm going to open the rooms and you'll just sort of land in your room. So I'm just doing that now. That's fine. So I'm glad we're all back into the main room. I hope the breakouts were worthwhile. If anybody's got any questions, just put your electronic hand up. This is the time to ask away, and just take your mute button off and ask the question, and we're all here to answer.
I'm speaking for Dominic. Sorry, Dominic did have a question, Liz, Jas, around the time scale for their reaccreditation.
Yeah. Liz, do you want to answer that one?
We're all fairly flexible, and we try to get it done before your accreditation lapses. If there's any kind of like we've obviously Josh alluded to earlier, we will happily extend accreditation so that you're not out of accreditation if we're working on, or we've got engagement from you, Dominic, in terms of the reaccreditation. So is yours due, do you know, or is it kind of work in progress? You might not know the answer to that, that's okay.
I just found a document confirming our accreditation from I don't know, sort of December, January 2017. Yeah, towards the end of 2017. But I think it took us a while to get there, but it was backdated to the beginning of the year. So I think we're 5 years in January if you count the back date. But we're not in a desperate hurry, and please feel free to forget about us for a while if you like. We
don't forget about anybody. We leave nobody behind. But don't worry, we're not going to kind of pursue you and make life difficult in terms of making sure you get your accreditation. Like I said, we will happily extend accreditation if we're working towards reaccrediting you. That's absolutely fine. But we'll look into that for you, Dominic, and we'll come back to you.
We'll stay in touch. Thank you.
No problem.
Thank you,
Tim.
Dominic.
I'm conscious that you had your hand up in our breakout room, and then we all came back into here very, very quickly. So you didn't get your chance to ask your question. Sorry about that.
No problem. And I think it's potentially already sort of been asked. I'm in a department where I've taken over as training officer from a previous. We've been doing STP for sort of 10 years now, and I'm just we've not had any accreditation information, and I'm not sure of the backstory of accreditation in my department. So how do I find out and get my email address to be the one that you contact? Is that
not a problem?
Something I just email you for?
Yeah, if you just drop by the Jas or myself, and we can give you there's a generic accreditation inbox that we tend to use, but obviously we've all got our own emails as well and our own inboxes. You can drop us an email and we can give you the email that you need to send an email to, and we can have a look at that. We can put you down as our lead contact if that's okay, and we will make sure that all of our correspondence comes to you. I think what we tend to find is sometimes things change within a department, and sometimes they forget to tell us.
Yeah.
Sometimes, you know, people have gone on to bigger and better things, or they've retired or whatever, and it just gets lost a little bit. And sometimes then we hassle many different other people trying to, when we do annual monitoring, because we're not hitting the right inbox with the information. So I'm very glad that you're here. I'm very glad that you've told us. Not a problem. We will come back to you with lots of information, and we can help you with understanding the backstory in terms of your accreditation for your department. That's not a problem at all.
Okay, thanks very much.
No problem.
Thanks, Tim. I have put my email address in the chat, and I've also put the link to the accreditation section of the website in case any of you needed to look at the information. I will also get this website webinar. It's recorded, so we'll be going on to our website in a couple of weeks' time, so you will be able to watch it back. And I will also send out a sort of PDF version of the presentation as well, so you've got all the information. Is there any other questions that anybody would like to ask? I think that's a legacy hand, Tim, I think, from yourself.
Jas, there was one on the Slido that I'm not sure was answered about keeping, if within service trainees, keeping the post.
Oh, yes,
available.
there's one here. Do departments have to keep a post available for in-service trainees who do not complete their training or wish to resign?
Ideally, what we say is, because they're still a member of staff and they move on to a fixed 3-year training program contract when they join the STP, you would expect that the expectation is that happens. It's very difficult sometimes to manage that in terms of if a trainee decides that the STP isn't for them, or they decide that they want to step off early. That is a very difficult ask, but we do expect that departments would do that. It's not easy to do. It's not easy to manage. It's very difficult sometimes when you've obviously backfilled that particular post and you've offered a fixed contract to somebody else to do that. But that is the expectation, especially because the funding is coming from HE for that particular individual for the 3 years that they're on the programme. So unfortunately, the answer is yes, we do expect that.
Okay, so
I can't see any more questions, Jas, at this moment in time.
No, so it's over to you, Helen, for closing the webinar then.
Yeah, I thought Graham was going to do
Yeah,
that.
I was just about to say.
Oh, okay,
yeah,
Graham.
Sorry, Jas. Helen and I chatted about it. We just thought that I'd do the close. I'd just like to thank. I know we've lost a few people. I understand everybody's very busy, but it's really great to see some really good comment in the chat that they've found today useful, which is, you know, what we were intending it to be. I know Helen and I have discussed how delighted we've been at the new names that we've seen of the people that have attended today, which again was another objective. We really wanted to bring in new people, and one of the things that we would like to do with this from this meeting is Helen and I again were discussing that we really would like to have a follow-up discussion on the commissioning aspect, so the pounds, shillings and pence of this and the actual process. We had a slide very early on about the commissioning cycle. We'd very much like to have a little bit more detail in that for our regional colleagues, and we will do that by going out to the healthcare science leads in the trust organisations and other provider organisations that we work with. So please, if you're not already your healthcare science lead, or you haven't contacted your healthcare science lead within your organisation, please do contact them. We've that tends to be, as I think again mentioned earlier, the primary route of how we get the information out to you. So that's something to watch out for. A follow-up on this webinar based upon the commissioning aspect, so you can ask some rather pertinent questions about how that whole process will go. It will also be an opportunity for us to try and capture you in terms of supporting Liz and her team in terms of shortlisters and interviewers. So yeah, I just thought I'd drop that in and just got the thumbs up from Liz. And I'd just like to thank you all again for engaging, and hopefully we will see increased interest. As Liz said, we're not ogres, we're here to help. If you've got queries, no question is too daft. Please ask. We're here to help, and we're hoping that we'll be able to put more resources into the region in terms of supporting departments to achieve accreditation, but also in terms of supporting departments to support their trainees as well. And on that note, I'd like to thank you all. And I think that's a goodbye from him and a goodbye from me.
Goodbye.
Take care, everyone.
Bye.
Thank you. Bye.
Bye.